Hi, my name is Carrie Med, and this video is for the literature review for SIMS499 and regarding skincare for neonatal infants. As a neonatal nurse, one of the most common injuries that are seen are those to the skin. For neonates, their skin is immature, thin, and highly susceptible to damage from positioning, touch, medical devices, diapers, IV infiltration, and many other things. Due to the high risk of skin breakdown, it's critical for our NICU to have steps in place to care for their small and delicate patients. Neonates usually only have 2 to 3 layers of their stratum corneum, which is the outermost layer of their skin, when under 30 weeks of gestation. They are at higher risk for skin infection. Typically, their skin should assist in providing thermoregulation. That's difficult for them due to the lack of brown fat when they're that small. And it also should assist in insensible water loss, which is also difficult for them, and they're at a great risk for dehydration. Additionally, they are extremely sensitive to touch, pressure, temperature, and pain, as well as having an imbalance in their skin pH during the first several weeks of life. All of these factors are considered during the literature review. And the literature review was completed with a focus on the purpose of healthy skin for neonates, the risk factors of skin damage, and preventative measures that healthcare personnel can take to ensure that the least amount of trauma affects the neonate and their growth and recovery. Brigham and Women's Hospital, Department of Pediatric Newborn Medicine, they created a clinical practice policy that outlined neonatal skincare back in 2016, and they did use recommendations and guidelines from the Association of Women's Health, Obstetric, and Neonatal Nursing. Those guidelines were created and approved back in 2013. So even though it's been a while, a lot of the things that we're reviewing are still the same, and some of them can be improved upon. Brigham Young recommended to complete assessments on neonatal skin daily with no clear guidelines on gestational age and those assessments required for their set age. Although the nurse is to assess for breakdown, rashes, redness, or dryness, these areas can change very quickly with neonatal skin, and they need to be assessed more frequently with minimal stimulation. Additionally, assessing skin under medical devices such as a nasal cannula or a feeding tube should be considered every 1 to 4 hours without disturbing the infant. The evidence-based clinical practice guidelines presented in the journal study Jognn, which is Jognn, in 2001 had several areas that are still used in practice today, so that was nice to see. When reviewing the literature, a focus on the effectiveness of skincare in the NICU was completed while addressing 10 different aspects of neonatal skincare. The initial objectives that they outlined in the study were successfully implemented and reflected change in care for both neonates and full-term infants. One of the areas was bathing infants in warm water that are weighing less than 1,000 grams, was consistent to bathing infants less than 32 weeks gestation with warm, sterile water for the first week of life, noted by Brigham Young. Although it is inconsistent how often younger infants should be bathed, one study recommended that it should be considered every 4 days. Emollients are also recommended, such as Aquaphor, for infants less than 32 weeks, as preventative measures in combination with an isolate that emits humidity. An isolate is what a lot of people consider an incubator. The humidity would be used for the first several weeks of life. This would be beneficial due to the extreme changes in skin integrity during the first month of a neonate's life and assist in reducing heat loss and insensible water loss. However, it's important to note some studies have shown improper handling of the emollient product can result in contamination and put the neonatal at risk for nosocomial infection. The use of skin disinfectants on neonates is consistent among all the literature. It is to be used to disinfect skin prior to invasive procedures. An example would be when placing an umbilical catheter either into the umbilical artery or vein for hemodynamic monitoring or long-term IV fluids or antibiotic therapy. Once completed, sterile water or normal saline is to be used to remove all of that disinfectant from the neonate's skin to prevent skin irritation or breakdown. One of the most common reasons for skin breakdown in neonatal infants all across the board is going to be adhesives. Additionally, a MARSI, or a medical adhesive related skin injury, is caused by improper removal of tape that can be traumatic skin injuries. Across the board, it is recommended to use a skin barrier between the neonate skin and the adhesive. An example of that would be a Duoderm or a Mepitech. Those are product names. Although some recommended removing any barrier or adhesive with normal saline or water soap gauze, it's also recommended to use a product that has a mineral oil in it or a solvent such as the product Detachol. That can be used to safely remove materials from the skin without breakdown. I always think of this too, when you have a little baby's face and you have an area that's covered that we think is really small, that's holding on maybe a nasal cannula. It may be small to us when we're looking at it, but it covers that baby's almost half of their face. And it's so important to try and protect the skin integrity as much as possible. Overall, the similarities are plentiful in the various literature reviewed. The goal remains to use the most gentle and safest practices to care for these small patients. Preventing skin injury and remaining as pain-free as possible is the main goal in order to keep them comfortable, growing, and healing in their delicate state. Thank you for watching my video.